Mississippi is moving in the right direction. We need a governor strong enough to take us to our full potential. We have a public health crisis in this state and in this country.
Mississippi Governor Tate Reeves is passing on $600 million in federal funding to expand Medicaid.
I will say no, even when powerful special interests demand a yes.
The expansion would benefit an estimated 200,000 to 300,000 Mississippians, 60% of whom are people of color.
What does it mean to be black in Mississippi in the midst of COVID-19?
The healthcare system is failing us. When you're poor, healthcare is not as good for you.
I'll tell you this, had she been, anything but black or brown, I think she would have gotten the care that she needed. They would not have sent her home to die.
Mississippi has the largest black population in the nation. African Americans make up more than a third of the population, but account for more than half of the state's deaths. Studies show blacks get inferior health care and suffer negative stereotyping by providers. In nearly every health category, Mississippi consistently ranks dead last or close to it.
While it would cost Mississippi about $300 million over 2 years to expand Medicaid, the federal government would pay for 90% of the cost under the Affordable Care Act, and the stimulus bill would give the state $600 million for expanding it. My name is Alyssa Bernardino. Thanks for being here. Expanding eligibility would make money for the state. The chair of the Public Health Committee, Hope Bryan, said that Mississippi would have more money in the Treasury if they decided to expand the program than if they didn't.
We have to get our spending under control. We have to get our debt under control. When I put the brakes on state debt, this place went nuts.
Tate Reeves stands on principle.
Mississippi's got less debt today than when I got elected. First time in history.
The unemployment rate in the Delta is between 30 and 40%, staggering numbers compared to the rest of the country. And then you put COVID-19 into the system and more places start shutting down, and the jobs, the minimal jobs that people had, are wiped out.
More of our people are working than ever before. We can make history when we make the tough calls. And that's what I do.
You know, we don't ever feel the effects of a depression because we stay in one all the time.
Let's not forget that the state has had the highest rates of COVID-19 deaths in the country outside of the Northeast. But Reeves, who ran for governor opposing Medicaid, claims that Mississippi voters don't actually want Medicaid because he won his seat in 2019 by a 5-point margin. Meanwhile, Lieutenant Governor Delbert Hosemann, a Republican who ran on expanding Medicaid, won his election that same year with a 20-point margin and 65,000 more votes than Reeves. Mississippi isn't the only state refusing money either. 11 other Republican-led states have refused to expand Medicaid, leaving 2.2 million people without health insurance in the middle of a pandemic. So if you're poor, black, indigenous people of color, good luck to you, because it doesn't appear Republicans care people are dying on their watch.
That's our mission. We can achieve it. Working together, Democrats and Republicans, and Mississippians from every region of our state. Thank you again for your confidence. I won't let you down.
Thanks for watching.